The only focus we ever have is taking care of the patients.
There's nothing more important than our people, but our people need the facility and the equipment to be able to operate in. So our facility needed to grow, and adding on to it was the next step for us.
It's very important to make a space that makes it efficient to render the clinical care so the staff can do the work that they are trying to do.
We're very excited about the new expansion to our hospital campus. We have expanded our facility by 100,000 square feet. This has allowed us to add a new lobby, a new emergency room, and additional inpatient beds.
The capacity of the emergency department before the expansion was 28 beds. We were in about 1,100 square feet.
In the new ED, we have 3 times the space, 53 rooms, private with doors, to ensure patient confidentiality and privacy.
We believe that every patient deserves to be treated with dignity and respect and in a confidential environment.
When we looked at designing the new ED, we took into account not only what our patients were saying, what our staff was saying, but best practices as well.
We specifically designed the space to speed up the delivery of care to patients.
We've changed how the patient is seen.
We wanted the process of being seen by a caregiver to start quickly.
We really wanted to move to the patient, not the patient move to us.
They're not being shuffled back and forth from a triage booth to the waiting room, awaiting a bed, into a bed, in order to get to another bed.
That's what we've accomplished by our use of the assessment unit.
A lot of work is done there. The patient is seen by a primary care nurse. The patient is seen by either a physician or a physician's assistant. It all happens in the assessment unit.
We've done something that's a little bit different than anybody else is doing, and we've taken almost all of the best things and put them together. In the past, healthcare was always looked at as a service industry, and it's come to that it's a customer industry as well.
It's so important to remember that the people that trust in us come from all walks of life, and we need to make them feel welcomed and support them in any way possible. In the new medical services building on Pomeroy Avenue, we have MediQuick, which is our urgent care center.
What I want people to know about MediQuick is the convenience and the quality of care and the quality of staff that's going to be treating you and examining you is quite unique.
We have a wound care center, sleep center. We have diabetes programs as well as bariatric programs available on that campus. It's important to offer care closer to where our patients live.
Here at the Mid-State Building, we have the walk-in center, we have physical therapy, radiology, and other physician offices. The value of coming into the walk-in is getting expert care that is fast and convenient. We have all the modern technology that's here for a patient, and we want to make the stay as welcoming as possible.
When people come into our new entrance and experience our new lobby, I want them to feel immediately a sense of, wow, this is a different type of hospital. This is not like any other hospital that I've been to before. I want them to feel the brightness, the warmth of the people that are greeting at the desk, and the ambience of an environment that is really here to provide comfort and healing.
Our patient is number one, what matters to them, and that's what we keep in mind.
I believe that all of our expansion, our facilities, the environment that we've created for the people we serve has positioned us beautifully for the future.
Now, we've built ourselves space where we can do the right thing for every patient and every staff member all the time.